Before we start, I'd like to say thank you to Rodney Dillon from the traditional custodians, the Palawa people, for your very warm welcome here to this beautiful city on this beautiful island. And I pay my respects to the elders past and present and to any Aboriginal people who are attending our gathering over the next few days. On behalf of the APNA board and the entire APNA team, I warmly welcome you to our 9th annual conference. I welcome you to the state-of-the-art conference for primary healthcare nurses to showcase their talents and their cutting-edge innovation in healthcare and embrace the opportunity to learn new skills, take home ideas, meet fellow visionaries, and an exciting 3 days in this beautiful city of Hobart. I extend a warm welcome to our dignitaries. Welcome to the Honourable Ken Wyatt, AM, Minister for Aged Care and Minister for Indigenous Health. Minister Wyatt has been very generous with his time coming here, particularly in a very busy week leading up to budget, and we are absolutely delighted to have him here. Thank you. We welcome our inaugural APNA patron, Dr. Rosemary Bryant. Rosemary was the first Chief Commonwealth Nurse, and we nabbed her as soon as she looked like she was going to retire. Rosemary's setting a very hectic pace for an alleged retiree. She has helped APNA review the Constitution, which was approved at the AGM last night. So thank you, Rosemary. I also warmly welcome Miss Lydia Dennett. She's the chair of the Australian and New Zealand Council of Chief Nurses, and Lydia is also the Chief Nurse of South Australia, so welcome. We have a number of representatives from the Commonwealth Health Department. We have policymakers and we have policy influencers attending our conference. We have attracted a wonderful array of speakers who are contributing to our program, and we're delighted to have you with us here in Hobart for the next 2 days to share in the excitement and the enthusiasm that is primary healthcare nursing. Now, in developing the concept for this conference, we asked ourselves, what are the attributes of primary healthcare nurses? How would we describe them and the way they work? Words popped up like science, applied science, innovation, sophisticated, and magical. And I say, yes, magical. Can a nurse pull a rabbit out of a hat? Well, yes, they can. Every day, they do it every day in their workplaces to care, to teach, to accommodate, to learn, seek and utilise resources to better help the people they care for. And often they pull many rabbits from many hats. The state-of-the-art theme reflects the dynamic role of nurses in primary healthcare as innovators and leaders in change in primary healthcare environment. Health reform is keeping us all on our toes. Nurses are smart, critical thinkers and pioneers of new models of care. Nurses are key to the successful implementation and continuing support for new programs and models of care. And this conference is named after you. So give yourselves a clap. Each year our conference grows and this trend continues. And we've moved from our original story of 6 nurses around the coffee table to 600 participants at this conference and several thousand members. It's a fantastic achievement in a very short amount of time. We will learn, we'll share our thoughts, you will take home messages and ideas to your workplaces and communities, and we'll definitely have some fun along the way. It's very exciting to see our organisation grow at such a rate. There will be people here for the first time, so don't forget to keep an eye out for those people with the gold stars on their tags because they're newbie conference members, so make sure you give them a big APNA welcome. And we know that the primary healthcare nursing workforce is growing, but the demand for services is also growing. We are seeing nurses jump from the tertiary system to primary healthcare, and these experienced nurses are bringing a rich skill set. We're seeing numbers of new graduates choosing primary health care as a starting point in their careers, but these new numbers are not enough. We need to renew the workforce and we need to attract more nurses. But most importantly, we need to keep them there. We need to support that workforce to feel valued and engaged if we are to meet the demands of a growing population and an ageing population with much more complex needs. APNA's vision is a healthy Australia through best practice primary health care, and to do this in a bold and vibrant way, in a future-focused manner. The State of the Art Conference gives APNA the opportunity to showcase the trend-setting work of nursing in the primary healthcare program, and we will have workshops for the transition to practice pilot nurses. You'll hear about the enhanced nurse clinic projects, and of course the most exciting part, the work being done on the career and education framework. We hear daily about the rising cost of health expenditure against GDP, and we hear personal stories of people trying to cope with multiple health challenges. The stories are from all our communities. 1 in 2 people identify as having a chronic health condition. There's 1 new diabetic diagnosed every 5 minutes. There's a rising burden of kidney disease, and dementia is estimated by 2020 to affect approximately 400,000 people. The growing demand for supported or well-supported aged services is also a significant issue for families, the government, and healthcare bureaucrats that will need to fund these services. How do we manage, using the cliche tsunami of chronic illness, how do we manage that? And the answer is strong, effective primary healthcare system, keeping people as well as they possibly can be with a reasonable quality of life and good support in their own communities and close to their family and close to their social support systems will be key as we move further into the 21st century. We need to do this in a manner that conveys respectful, effective care, and in a way that maintains high quality and safety of the care that's being delivered. There is much effort being put into how we can better manage the burgeoning chronic disease workload and give access to patients to health services that they need and that they deserve. The Healthcare Homes pilot is due to start later this year, and you will have the opportunity to quiz the panel later today. There are also a number of other high-profile CDM projects happening around the country. The success, though, will be in delivering care that is relevant to each patient in their own community. Who is going to deliver this care? How will this care be delivered and the desired outcomes of any program actually achieved? Nurses are the key to this upstream approach to care. You've heard me say this before, but nurses are the most geographically spread group of health professionals. They are in every community, from the busy inner city to right out in the sticks, rural and remote areas, where they may be the only health professional that those communities can have immediate access to. If a program is going to work, it will need nurses as the key drivers. When we ask the what, the who and the how of healthcare delivery, it's you. The nurses that will assess and know the needs of your local communities, and nurses must and will be key to determining and delivering innovative and creative care models that can be applied in the local context to help their communities. Over the next few days, you'll see showcased the APNA enhanced nurse clinics. Nurses are ranked top of the list as highly trusted and respected health professionals, and there is a strong recognition that the work of nurses is vital to the provision of high quality health care that's accessible and locally based, keeping people out of hospital. Yet nurses in primary health care often lack the support and acknowledgement of their skill set, and the work of the APNA Nursing in Primary Healthcare program aims to turn this around. We have transition to professional practice pilots with nurses located in diverse settings around the country, including Aboriginal health, general practice, aged care, Community and corrective services are just a few of the areas that we have clinics and nurses in transition. All of our projects, when we put out a call for joining the projects, were subscribed by at least fivefold, which just goes to show the great demand. The current work on the career and education framework will be showcased over the next few days, with a formal launch due later in the year. The work of the projects is generating a lot of interest. The work on these projects has been well received by both the government and external stakeholders, so hopefully you will hear a lot more over the next few months of the directions that APNA is hoping to take with that work. We thank the federal government for the investment in the Nursing and Primary Healthcare program, and these projects are funded until 2018. We need to keep working on innovative ways to support our communities, and we need to look at further funding to allow the support of the nurses who support those communities. APNA is already looking at ways to how we may further support this, and we will be seeking further investment to continue that good work. I'm proud to lead APNA as our profile continues to grow as the go-to organisation for primary healthcare nurses. APNA, as your peak body, will continue to lobby and advocate on your behalf to deliver high-quality professional development that we need to drive contemporary and creative healthcare. We hope you enjoy the next few days. A big thank you to our sponsors that help make this event possible. Make sure you visit all of their booths, get your things stamped, and don't forget the pearls. There's a prize draw for $2,500 strand of pearls. Now, before I go, I would like one last hurrah. Before I let you go, I'd like to thank long-time board member Julianne Badenoch. Julianne is stepping down from the board after 14 years, and we gave her a big clap and a trophy last night at the AGM, but I think for 14 years of service to APNA, she needs another clap. She's not completely off the hook though, because she will continue in her ambassadorial role representing primary healthcare nurses on a number of committees for APNA. A clap for Julianne. I want to thank you for joining us at the 9th National APNA Conference, for bringing and sharing your expertise and your enthusiasm. And now let the conference begin. Thank you.
Thank you, Karen, and welcome to the APNA patron, office holders, and of course board members as well. They're such a pleasure to deal with, all of your team. For the people standing at the back, if you're not part of the APNA team, we do have some chairs down the front. You are more than welcome. Only the naughty kids sit at the back of the bus. We know this for a fact. Ladies and gentlemen, we are delighted to have the Minister for Aged Care and also Indigenous Health with us today. In 2010, as the federal member for Hasluck, an electorate south-east of Perth, he made history as the first Indigenous member of the House of Reps. In 2015, he became the first Indigenous member of the Federal Executive after being sworn in as Assistant Minister for Health. He's responsible for aged care, service delivery and implementation, as well as dementia. Before entering politics, he worked in community roles in the fields of health and education, including as District Director for the Swan Education District, Director of Aboriginal Health in New South Wales and Western Australia, and of course was awarded the Order of Australia. Would you please welcome the Minister for Aged Care and also Indigenous Health, the Honourable Ken Wyatt. Morning, Ken. Welcome.
Thank you very much. Can I acknowledge Mr. Rodney Dillon, Palawa Elder, and the traditional owners of and custodians of the land on which we meet today, and I extend my respect to their elders, past, present and future. And when I listened to you, Karen, I thought your comments about being hard to follow Zara and Troy was bad enough, but when you talk about nurses being at the top of the most trusted of all professions, and I look at where politicians sit on that list, it's an incredible contrast. And I'm always nervous about talking to nurses because there is not one part of this country that you are not found. And when you're giving a speech, you know that you sometimes might upset somebody, but that person you upset might be the very same person that treats you when you walk into a health centre. And they quietly say to you, and I had this happen to me at Orange. I walked in and, because I had a couple of PEs that that was eventually diagnosed, and she said to me, "I know you," and I said, "No, you don't." And she then said, "What's wrong?" So I described what was wrong with me, and she said, "We'll have the young doctor come shortly," but she said, and she said to me, "I know you." And one orderly came past and he said, "You've got the Director of Aboriginal Health in your bed there," and she came in and said, "I told you I knew you." She said, "You didn't fund us for a program that we asked for funding." And that's why as a profession, you've got some incredible corporate memory. And so I'll be very measured in what I say. My thanks to Karen Booth, APNA President, for your opening address and for your acknowledgement last night. Our conversation was both warm and rewarding. I acknowledge other Aboriginal and Torres Strait Islander people here today, and I'd also like to acknowledge Mr. David Malone, your CEO, Dr. Rosemary Bryant, APNA patron and former Commonwealth Chief Nurse and Midwifery Officer. And it was good to catch up with Rosemary because I've known her for some time, and it was good to catch up with a friend. Nick Marchese and the Lucas Patchett from Orange Sky Laundry, Dr. Bastian Siddell, President of the Royal Australian College of General Practitioners, and Mr. Phil Edmondson, CEO of Primary Health Tasmania. I want to start by saying that this government deeply values the contribution of nurses in our communities, and we also value your insights on the way that we can improve health service delivery. The nursing and midwifery workforce is the single largest health profession in Australia, almost 3 times the size of the GP workforce, 34,600 GPs, compared to 315,100 nurses, and that's why I have that fear. The ratio is great on your side. And work across a range of settings from general practices to schools, prisons, community health, pharmacies, and in aged care. You play a critical role in maintaining safe, high-quality healthcare within our primary healthcare system. This gives you a unique perspective in understanding what's working and where we can improve. The theme of this year's conference, State of the Art, is timely in this regard. Our society is changing. Our health system is changing. Nursing is changing. I believe nurses will continue to play an increasingly important role in the evolution and delivery of primary health care in this country, and I welcome your ongoing input into our journey into the future in providing healthcare to people. Your profession's journey is a long way from the time of Florence Nightingale to our contemporary health system of today, and it's a remarkable evolution and transformation. Strengthening primary healthcare through modernisation and innovation is one of the central pillars of this government's long-term National Health Plan. It is essential that our health system has the flexibility to meet our current and future demands while at the same time remaining financially sustainable. This means moving away from one-size-fits-all approach to health policy and towards a system which is wrapped around the individual health needs of the consumer. The creation of the primary health networks in July 2015 was one of the first steps in this process and an important one. Since that time, the 31 PHNs around the country have been doing extensive planning and consultation to really understand the health needs of the people who live there, not only now, but moving into the future. They are working directly with nurses as well as GPs, allied health workers, including psychologists, physiotherapists, local specialists and hospitals. This approach will bring new opportunities for nurses to strengthen their role in the delivery of primary healthcare services at this local level. Healthcare homes is a good example of where innovation and new models of care will lead to better patient outcomes and an enhanced role for nurses working in primary health settings. 10 selected PHNs are right now preparing for a stage 1 of the healthcare homes. This includes Primary Health Tasmania, represented here today by their CEO, Phil Edmondson. 200 medical practices across the 10 PHNs will identify and enrol patients with chronic and complex conditions that can benefit from a team-based care into the healthcare program. Nurses will play an essential role, working together with GPs and other health professionals to design a coordinated care plan for each enrolled patient, taking into account local health, social, psychological support services that they will require. It's hoped that this approach will delay or prevent patients' chronic conditions from worsening and help them to avoid hospitalisation. The Australian Government is also investing in initiatives to expand the role of nurses through increased workforce participation and capacity. Last year, the Government established the National Nursing and Midwifery Education Advisory Network to provide advice on planning, coordination of education, employment and immigration for nurses and midwife. In particular, this advisory network will help to inform policy and innovation to improve the effectiveness and sustainability of the nursing and midwifery workforce. Ms Karen Booth, President of APNA, is a member of this network representing one of 5 professional nursing and midwifery associations. We are working closely with the Australian Primary Healthcare Nurses Association to deliver other activities to support nurses in their primary healthcare settings, and you'll hear more about these activities during this conference. The PHNs are also crucial in the delivery of mental health nursing services, which form part of the regional level planning for mental health and suicide prevention planning. Mental health nurses are part of a more holistic approach to mental health care and prevention services, as they work closely with clinical care providers to support people experiencing mental ill health, their families and the community. These nurses perform a wide range of roles, from promoting good mental health, prevention support, to clinical and therapeutic intervention. The Australian Government is also committed to support the Australian College of Mental Health Nurses to develop new workforce models that promote a sustainable and flexible mental health nursing workforce. More broadly, we support scholarship programs aimed at increasing health workforce participation, particularly in rural and remote communities. The Nursing and Allied Health Scholarships will become part of a broader and more streamlined health workforce scholarship program later this year, and will provide the scholarships and bursaries to students who are committed to working in the bush. People, no matter where in Australia they may live, should expect the same standard of healthcare, and this initiative will help to ensure that we have the right health professionals in the right areas. We have also invested $6.5 million over 3 years in the Nursing in Primary Healthcare initiative to boost the number of nurses working in frontline health services, including in rural communities. This initiative is building the capacity of nurses in primary healthcare settings and encourages reform and innovation to better address the health needs of those in our communities. The Practice Nurse Incentive Program is also supporting nurses working in general practice to work to their full scope of practice. Its incentive payments of up to $125,000 each year help to offset the costs of employing a practice nurse, allied health professional or Aboriginal health worker or practitioner, and we can take some of the pressure off the GPs in busy practices. The Government's ongoing support for other programs such as the McGrath Breast Cancer Nurses and Prostate Cancer Foundation's Prostate Cancer Nurses is also helping to expand the role of nurses in delivering great outcomes and supports for patients and their families following a cancer diagnosis. In aged care and palliative care, other areas where nurses are increasingly making an even greater contribution to improve patient care. The Government is working with the aged care sector to ensure we have a capable and responsible aged care workforce in the future. And nurses and other allied health professionals can play a stronger role here. Many of our elderly people have complex health needs and need support to manage their conditions. but the vast majority of them want to stay living in their home for as long as possible. Early intervention, monitoring of medication, and regular reviews can reduce the need for expensive and disruptive hospital admission. Supporting people's health and independence is the key to meeting our expanding need for quality and affordable health and aged care. And quality health care and support remains just as important when we are near the end of our lives. Nurses make up the majority of the registration of Australian government-funded palliative care projects that enhance the capacity of health professionals to deliver quality care. Having a dynamic and flexible health workforce is key to an effective and efficient health system moving forward. In an environment of evolving models of care and scarce health dollars, there is scope for nurses to play a greater role in supporting the primary healthcare needs of our communities. The nursing profession has already contributed much and now is poised to take a leading role in the evolution of our health system against a background of increased demand for services. Your conference will explore ideas on cutting-edge innovation in service delivery, better models of care, quality and safety, and leadership in nursing. I encourage you to embrace these ideas and see how they may be applied to your work and the nursing profession more broadly. And on a personal note, I just want to thank all of you in nursing for the work that you do. When I go through any facility in this country that looks after and cares for people, I see individuals who are compassionate, who care, who take the time to nurture the relationship with the family, who's experiencing grief and, in times, challenges about the situation that they face. I look at the nurses in Children's Hospital whose manner and approach to comforting parents who are wondering about the outcome of their child's situation. And so on that, thank you for what you do. Thank you for that compassion, and thank you for the way that you consider others above yourself. And I wish you all the best in your deliberations. Thank you.
Thank you, Minister. Thank you so much.
Wonderful.
Don't go too far away though, Minister. We are going to get you to assist us very shortly as we welcome back Karen Booth, APNA President, and David Malone, APNA CEO. Please put your hands together for those two. It's time for the APNA Nurse Awards, Zara.
Indeed it is. And as they're making their way to the stage, I was just given a little bit of breaking news from one of our wonderful delegates over there who's handed me a piece of paper that says, Zaza, thank you for that. Zaza, today is International Midwives Day.
Oh, wow.
It is. So, do we have some midwives in the room? If you are a midwife, can you stand up? Let's see you, you magnificent people who create life and wonder. Thank you for the work that you do. This is your day. Wonderful. Let's celebrate them, or if in fact anyone that was born, it's worth celebrating
Yes.
right now too.
Very true.
David, as Karen and the Minister take their seat, this format has changed slightly, hasn't it? Because a couple of years back, when we joined you on the Gold Coast, the awards were part of the evening ceremony, but I know you wanted to bring them forward into the main conference, the plenary, so that people felt like winners right from the beginning, and we could celebrate our colleagues. Is that part of the rationale?
Yeah, look, that's absolutely right. And good morning, everybody. All of our guests, our special guests, all of the delegates, and in particular APNA members, welcome to you. And this is the APNA Awards ceremony. And Zara's right. We've decided to bring this into the plenary program right at the very start in front of everybody to give it the prestige we think these awards deserve. And I'll talk a little bit more about that in a second.
I look forward to that. Take it away, David.
Thank you, Zara. It's incredibly important for a profession and for a professional body to recognise their champions. And advancing the profession and increasing the recognition of primary healthcare nurses is a key objective of APNA. And recognition starts within a profession. And that's why these awards are so important. In 2016, the APNA board agreed to restructure the APNA Awards framework. And the reasons that the board did that was to create an ongoing consistent legacy of award giving and build up a history of award giving that would build on the previous 10 years history of best practice awards. and also to recognise that there are different levels of contribution that nurses can make at different points in their career, which are all equally important. And so this is about recognising the profession from within the profession first, and a very important first step to advancing the profession more broadly. APNA's award framework consists of 4 awards, and I just want to give you a little bit of an explanation about each of those. The President's Award is a highly prestigious award that is honoured on an individual who has made an outstanding contribution to primary healthcare nursing and whose efforts have left a lasting legacy. And that lasting legacy element is a very key feature of this award, and there'll be a little bit more about that later. It's a discretionary award that is not awarded every year. It wasn't awarded last year. It may be awarded to a nurse or a non-nurse. It is proposed by the President and approved by the APNA Board. The second award is the Rosemary Bryant Award. This is an award for a nurse and APNA member who has made a substantial long-term contribution to advancing excellence in primary healthcare nursing. Like the President's Award, it's proposed by the Board and approved by the Board. And the award is named after, of course, our patron, our inaugural and current patron, Dr. Rosemary Bryant, to recognise her dedication and advocacy of nurses working in primary healthcare. We're very pleased to have Rosemary here today to present her award. She was unwell and unable to attend last year, so it's the second time this award's been presented, and we're so pleased you can be here this year, Rosemary. The winner of the Rosemary Bryant Award last year was Valmay McKenzie. The other awards I'd like to just explain are the APNA Nurse of the Year Award and the APNA Recently Graduated Nurse of the Year Award. These awards are based on an application and selection process where there's a call for nominations, a selection party is put together, and the award is determined that way. These awards are for a nurse and an APNA member who has demonstrated leadership and excellence in the field of primary healthcare nursing. Someone who inspires nurses and primary healthcare professionals they work with. Someone who provides a voice and advocates on behalf of nurses and their local community. Who contributes to improving outcomes for patients and their communities. And in the case of the APNA Nurse of the Year Award, is someone who also has given back, who contributes to their field. Anyone can nominate someone for these awards, a manager, a co-worker, a colleague, a patient, a friend, and we received applications in all different manners this year. To be eligible for the award, you need to consent to be nominated, to be a registered nurse, enrolled nurse, midwife or nurse practitioner, currently registered with AHPRA, to be working, of course, in a primary healthcare setting, to be a member of APNA. APNA board members are excluded from these awards, and be available and committed to working as an APNA ambassador over the period of the next 12 months. The selection panel for these awards this year was 2 of our board members, Kathy Godwin and Ken Griffin, and a prominent and long-standing member of APNA, previous President Anne Mattia. So thank you to the selection panel who worked very hard to work through all the nominations for this particular award. So with that explanation, I'll now move into the awards ceremony, and I'm very pleased to see the Minister here. Just to add my thanks for your coming here, Ken, and our President, Karen Booth, will help present these awards. So the first award that I'm pleased to present, or pleased to announce today, is the Recently Graduated Nurse of the Year Award. And in this category and in the APNA Nurse of the Year Award category, there will be 2 finalists and a winner for each category. And we'll have them all here today, the finalists and the winners, and we'll get them up on stage. So I'm very pleased to announce the first finalist for the APNA Recently Graduated Nurse of the Year Award is Robbie Bedbrook. So, Robbie is a primary healthcare nurse working in general practice in the busy inner west of Sydney. He is passionate about public health and social justice, and he manages the Hot on Health project. Hot on Health is in response to the rise of technology, search engines and social media, and is designed to inspire people to seek out primary healthcare services using modern technology. Robbie is also working closely with the Haemophilia Foundation of Australia to create a video package for patients with bleeding disorders transitioning from paediatric to adult care. Well done, Robbie. Stand here, Robbie. The second finalist is Jetta Rowton. Jetta works in a general practice in a northern suburb of Wollongong in New South Wales. She has a passion for chronic disease prevention and management. She has assisted in the creation of a mini health assessment for people aged 50 to 74 at risk of developing type 2 diabetes. Jetta has established relationships and referral pathways with local service providers such as exercise physiologists, dietitians, aquatherapy groups to further support patients to reduce their risk of diabetes. And I'm very pleased to announce that the winner of the recently graduated Nurse of the Year is Maria Young. Maria commenced as a graduate nurse in 2016 and works at the remote Mudjinjini Multi-Purpose Health Service on the Queensland and New South Wales border. Maria currently works in the medical practice, community health, aged care and in the hospital. Maria assists with the quality portfolio and now holds the productive ward portfolio. She has completed her immunisation endorsement and has commenced a graduate diploma in rural and remote health. Maria has recently worked with 2 colleagues to set up a health store for the local show and demonstrates enthusiasm about how this initiative will benefit her community in the long term. Maria is a strong advocate for her patients and her community and is showing incredible strength in leadership as a junior RN. So well done, Maria. So please join us as we congratulate all our finalists and winners. Thank you. They're all so young. Makes you feel a bit old. The next category of award is the APNA Nurse of the Year Award. And once again, we have 2 finalists and a winner. The first finalist of the APNA Nurse of the Year Award in 2017 is Kim Rayner. Kim is a registered nurse working in Brisbane. She's established 6 programs based on nurse-led integrated models of care to address the health needs of vulnerable people who are homeless or vulnerably housed with complex health and social support needs. Kim is also committed to supporting other nurses to care and advocate for people who have been excluded from existing health services. The second finalist is Joanne Wilson. Your hands will get tired by the end of this session, but that's a good thing. Joanne is a nurse practitioner based in Perth. Joanne works as part of the homeless healthcare team, providing primary healthcare services to people who are homeless and marginalised. Joanne has coordinated and implemented a comprehensive survey regarding patient experiences and perceived changes in health. Preliminary findings from the survey indicate that positive health outcomes are evident when people experiencing homelessness are linked in with homeless healthcare. So congratulations, Joanne. And I'm really pleased to announce the winner of the 2017 APNA Nurse of the Year is Holly Robinson. Holly works as both a practicing RN and midwife in a Sydney general practice, where she is also the practice manager. Holly is directly involved in providing education and teaching to patients through nurse-led clinics. She sits on various committees that aim to improve the health of patients, particularly those at high risk. Holly has also been supporting undergraduate nurses and new graduate RNs. Congratulations, Holly. Okay, once again, congratulate the award winners and finalists. Thank you. I should have also acknowledged we have in the audience today the winner of last year's recently graduated Nurse of the Year award, Candice Pravasco from Adelaide. So thank you. Nice to see you here, Candice. The next award to be presented is the Rosemary Bryant Award, and it gives me great pleasure to invite up to the stage to present the award named in her honour, our patron, Dr. Rosemary Bryant.
Thanks, David. Well, good morning, everyone. It's really lovely to be here. As David said, I was unable to make it last year. I actually was, I think, unconscious. I had a subarachnoid hemorrhage. So I'm very pleased to be on my feet, standing up today. So it's with great honour that I will be presenting the Rosemary Bryant Award today. The winner of the Rosemary Bryant Award this year is Jane Butcher. So congratulations. I just have to read out.
Okay, what they put there,
Yes,
yes.
I do, yes. So, Jane aspired to be a nurse from a young age and did her undergraduate nursing education in Western Australia. She became involved and committed to primary health care and nursing when she and her GP husband Michael set up a solo GP practice in Kalbarri, a small coastal town approximately 600 kilometres north of Perth. In 2000, Jane worked for a small practice which was bought out by a corporate firm and merged into a new purpose-built practice. The GPs at this practice all enjoyed working with Jane and respected her knowledge and care of patients. She became the senior nurse over time and from there became more interested and active in supporting practice nurses generally, including improving pay rates, continuing professional development and recognition of the role. Jane then moved on to roles within the divisions of general practice, you remember them, then Medicare locals, and eventually became the state program manager for the Nursing and General Practice program, funded by the Commonwealth Government. Jane is very well known and respected in primary health care at all levels, from grassroots practice nurses to high-level health department committees. She is passionate about improving primary health care nursing and working towards better health care for the community, both locally and nationally. Jane has also significantly contributed to APNA. She was a board member between 2011 and 2014 and has served on numerous committees and undertaken various pieces of work for APNA. Jane has been described by her colleagues as great fun to work with and have on your team. She has a wicked sense of humour, is one of the kindest people you can meet and is always helping others, both professionally and personally. So congratulations, Jane, on being awarded the Rosemary Bryant Award for 2017.
Thank you very much.
Now, I need to hand you... Do you want to say something?
No, I'm fine with that.
No, okay. We'll just come over here. Where's the gloves?
I did just want to say, sometimes when you're beavering away in WA, you do wonder if anybody's actually taking any notice of what you're up to. And obviously they have been, so I would like to thank APNA, the WA Practice Nurse Association, and everybody else who's given me so many opportunities over the years. When I started my nursing, I never thought I'd end up in primary health care because I only knew about acute care. But having worked in a little country town, developed skills, it was just obvious that's where I needed to be. And over the years, it's been a challenge, getting up at 6 o'clock to do teleconferences in the morning, finishing off teleconferences at night, telling my boss that it's 5 o'clock, I'm actually on a teleconference, could you just, wait while I get out of the building? So it's been really good. And my challenge to everybody, and as everybody has actually said today, it's not about being state of the art. It's not about shining. It's about putting ourselves on the agenda, making sure that we're front and centre and leading the charge to put primary healthcare nurses on everybody's nursing agenda. And I would really like to thank my long-suffering husband, who has supported me, and my friend Gay Nuttall, who has been on this journey with me for the last 20 years. So thank you very much.
It's now my pleasure to invite up to the podium APNA President Karen Booth to present the 2017 President's Award.
As David said, this isn't an annual award, and we also save this award for exceptional nurses. And today I'd like to present the President's Award, and the winner of the President's Award this year is our founding member and founding president, Samantha Moses. Samantha. And like the opening said, from little things, big things grow. From the 6 nurses to the many nurses here today, Samantha is a seasoned registered nurse, founder and inaugural president of APNA. In 1999, Sam identified the need for nurses working in general practice to have dedicated support network for this and then this unique area of nursing. Sam is very committed to the cause, and in her own time and with the support of her colleagues, advocated and garnered support from various individuals and organisations. Sam's vision was realised after much hard work and dedication when the government and other key nursing bodies provided the seeding support to grow APNA into the organisation that it is today. Sam remains a nurse consultant and also consults for APNA today. She's a primary care nurse consultant with over 20 years' experience and currently works on the very beautiful Mornington Peninsula. And she has a very nice horse. She sent me a photo. She's a manager of a dynamic holistic general practice, and she remains committed to the advocating for and advancing the role of primary care nurses in Australia. I would like to say congratulations to Samantha on being awarded the President's Award for 2017.
Congratulations.
Wow. It's very overwhelming to be standing here in front of all of you. I wanted to bring my phone up on stage and actually get a picture of all of you. Look, so many people to thank. Thank you to the APNA board and to the APNA team who have become like family to me over the years. They work tirelessly all year round, not just at conference time, to develop the tools and provide support to their members. I can't think of another nursing organisation that you are able to ring at the drop of a hat and have a nurse on the end of the phone, member or not member actually, to be able to talk to you and provide support to you. So it's unique in so many ways. I never dared to dream that this would happen. From working in general practice in a sort of an isolated role by myself in a general practice, and just wondering what on earth everybody else was doing, whether or not there were other nurses out there like me, and whether or not they were interested in networking with each other, whether they, where did they get their education? What did they do? How did they find out the things that they needed to find out? So it was that thought that came to me. I don't know why or how. And then, of course, it was just talking to anyone who would listen, including local members of parliament, reps that used to visit, the divisions of general practice back then, and they were all so supportive in helping me get the question out to people, are you a nurse in general practice at that time? Do you want to network with other nurses, and how about some education? And that expression of interest that went out through the ether came back as an overwhelming, screaming yes. So from there, it snowballed. I don't have a lot of time, but I just wanted to talk, I guess, basically about the opportunity that APNA has given me over the years. It has provided me with immense personal growth. It forced me to learn how to use PowerPoint. Is that a good or a bad thing? I'm not sure. It forced me to stand in a room full of people like this for the first time at Lorne on the coast in Melbourne, and talk to a room full of GPs about why they should have a nurse working in their practices, because of course at that time it was very general practice focused. And my husband, bless, who's not here today but he's coming tonight, took the day off work and drove me to Lorne so that I could do that presentation, and sat in the audience and gave me the thumbs up halfway through, so provided me with the support. I mean, I have met some amazing people through this journey. I have travelled. I've been to places I would never have gone to if it wasn't for APNA. I've had education opportunities that I would never have had if it wasn't for APNA. I've had the privilege of meeting people like the Honourable Ken White and the Governor of Australia, the Governor of New South Wales. I went to Government House. I've done so many amazing things because of APNA. I've met all of you over the years, the people that I've met, fascinating, interesting, dedicated, amazing nurses because of APNA. Facilitation skills. I mean, it has opened for me a whole world. So thank you to APNA and to all of the members, because if we didn't have members, we wouldn't be here. So thank you all very much. I treasure this award. It means the world to me. And I'm very excited to see what APNA's future will bring to all of us and Australian nurses who are working in primary health care. So thank you very much.
So that brings us to the close of the awards ceremony. I'd like to thank the Honourable Minister and our President, Karen, for their assistance in the process. Rosemary Bryant, congratulations again to all the awards winners, And as far as the legacy of the President's Award, look at this legacy for Sam, and it's quite amazing. So congratulations. If we can join with me in congratulating all our winners.